Well, good afternoon. Today I'm pleased to update you on plans to expand childcare services as we begin to reopen our economy. And joining me for the update today is our childcare specialist, Carolyn Simpson, who official title is our Early Years Advisor. Now, our priority during this phase is to ensure that childcare is there for parents who are returning to work. On May 22nd, we will begin phase 2 of our plan to gradually and safely expand childcare services. We understand with the closing of childcare centers and schools, additional stress has been placed on island families. We really do understand that. And we understand that access to childcare is really critical for working parents. However, if you are a parent working from home and need help finding childcare, please register, and we will do our best to help you. So once again, if you are working from home and need childcare, definitely register, and we're going to do our best to help you too. As the Premier indicated this week, both licensed childcare centres and private home-based care will reopen May 22nd. Emergency childcare services will continue until then. Government and all islanders are deeply grateful to our early childhood educators and operators who really have stepped up over the past 8 weeks tremendously to care for the children of our essential workers. We are also very appreciative of the many employers who have supported their employees to work from home. And of course, the parents, guardians, big brothers and big sisters that have stepped up to help. Thank you for doing your part to ensure that essential services could continue for Islanders. We really could not have done this without you. Les éducateurs de la petite enfance jouent un rôle important pour permettre aux familles de travailler et d'élever leurs enfants. Nous apprécions leur travail exemplaire au cours des dernières semaines et au fur et à mesure que nous progressons vers l'ouverture sécuritaire des services de garde des enfants. Today, we have 500 families and 950 children participating in emergency childcare services. And a special thank you to Carolyn and her team for making that happen. Of these, the vast majority are using private services such as having a friend, relative, or babysitter care for their children. As we reopen services safely and gradually, we encourage parents to continue using these services during phase 2, if at all possible. And on May 22nd, the number of licensed centres operating will increase from 22 to 155. And current public health guidelines will continue. For example, care will be offered in groups of 5 people and there will be no more than 20 people in a centre. Enhanced hand washing and cleaning protocols will be followed, and staff must practice physical distancing and children wherever possible. Remember, safety is our first priority. Priority in licensed childcare centres in phase 2 will be given to parents who must leave home to work and who have no other childcare options. For example, parents who work in sectors opening up in phase 2, such as fishing, construction, and landscaping. If your child was in a licensed centre before COVID-19, you will have priority to return to that spot. But if you are not returning to work during this phase, you will not lose your space in the centre. Just to repeat, you won't lose that space. Essential workers now using licensed childcare centres will continue to have a space in the licensed centres, so they don't need to worry either. Given the guidelines and limited capacity in centres, we understand that it may be more challenging for some families to find care, but I want to assure you, we are committed to supporting all families. For example, based on CPHO guidelines, group care is not available at this time for infants. That said, if parents of infants need help, please contact our staff and we will do our best to support and guide you to find childcare. Private childcare services will continue to be the recommended option for immunocompromised children in phase 2. However, some of these children may be able to return to a licensed centre with the approval of a medical practitioner. Operators are now reaching out to families in their centres to identify their needs. And once that is determined, they will offer any remaining spaces to parents who have requested one. Parents who are unable to secure a space and have no other childcare options are asked to go online to our website, princeedwardisland.ca/childcare services, and tell us about your childcare requirements. We need to find out what the demand is. Staff in our department will then contact you to support your needs. Recognizing the critical importance of childcare to parents going back to work, parent fees will be reintroduced gradually. We do not want costs to be a barrier for parents returning to work. To help with childcare costs, government will provide a childcare allowance to all families that are using both licensed or private services. So whether you're using licensed or private services, if you're paying for childcare, we will provide a childcare allowance. The allowance is $75 per child per week until June 26th, when the school year ends. For parents who have a spot in a licensed center, the allowance will be reduced from your fee. For parents using private childcare services, there will be an application form to complete, and this will be made available when Phase 2 begins. Families may also be eligible for the Provincial Child Care Subsidy Program based on your income and family situation. You can see if you are eligible for the child care subsidy by using the child care subsidy calculator on the government website. So we expect up to 3,300 preschool and school-age spaces to open up in Phase 2. At the same time, we understand that need for school-age spaces may be greater this spring as schools are closed to regular classes. So the licensed early childhood centers have been providing the department with the numbers of children that they are able to enroll safely under the CPHO guidelines. And if there is not enough capacity in a center, then those spaces will be offered within a school. We are having conversations with community partners such as UPEI, Holland College, and municipalities to allow them to safely operate day camps for children. Now, private home-based centers will also reopen on May 22nd to their full capacity. So there are more than 300 home-based childcare centers, and they will be permitted to take in up to 7 children while practicing physical distancing in the home, based on their COVID-19 operational plan, which will be required by the CPHO. Now, going into Phase 3, which is now scheduled for June 1st, the further expansion of childcare services will depend on how well we are doing in reopening our province and the public health and safety requirements at that time. As we learn to live with COVID-19, we will continue to evaluate the way childcare services are delivered. And in closing, I just want to say thank you once again to all those who are supporting our children and families during these challenging times. Je remercie encore tous ceux qui appuient nos enfants et leurs familles durant la pandémie. Decisions to further expand childcare gradually and safely will continue to be made in the best interests of all islanders, and particularly the safety and well-being of our children. Notre priorité absolue doit toujours être la sécurité et le bien-être de nos enfants. I'll now ask Carolyn to say a few words, and then we'll open it up to questions. Thank you. Merci.
Thank you, Minister. I too would like to thank everyone who has come together in support of our children and their families over these last few months. As we continue to move forward with Reopen PEI together, and specifically to safely and gradually reopen childcare services, top of mind for everyone will continue to be the health, the safety, and the well-being of the children, the staff, and their families. We have worked closely together with CPHO and the early childhood sector to develop the plan for Phase 2. And we will continue to monitor closely and make changes as needed. So again, thank you everyone for your patience, your cooperation, and your understanding. Minister.
Well, thank you, Carolyn. And one thing I also wanted to add is that we are committed to supporting families of children with special needs. And centers are working with families directly, and the education team is helping to support children with special needs on a case-by-case basis. Schools are also supporting school-aged children with special needs through the respite care program and other student services. And operators are now reaching out to families in their centers to identify their needs. So at this point, I'd like to open it up to questions.
Carrie Campbell, CBC.
Yes, I just wonder, first of all, maybe for the minister, if you could answer this. I just wonder with the news today that BC is going to open its schools on June 1st. I just wonder what the difference is between, opening up childcare centers and allowing kids to congregate there versus opening up schools and allowing kids to go back there, and kind of why the decision was made to go in this direction.
Well, thank you, Carrie, and it is a good question. And I think it's really important to note that public safety is the number one priority. And when it comes to public safety, we're working with the experts, which is the Chief Public Health Office. And there's a lot of complex considerations that go into their decisions. And this is the direction that they're giving us. And we're moving back into offering childcare in groups as much as possible based on their direction.
Okay, and I was not clear. You talked about if there's more students enrolling or kids enrolling than there is capacity, that spaces will be offered within a school. So can you just maybe explain what would happen in that case?
So what happens, of course, is you have for example, you have a center that has had a certain capacity for taking in children prior to the pandemic, but now under the CPHO guidelines, that capacity is reduced. So what we're doing is we're going to fill up that center to capacity, and if there are still parents that require childcare, we're going to go to the local school, and we're exploring how we can use the space in that school to provide additional childcare to parents that need it, because of course the centers would be full at that point.
And I don't get a third question. Okay.
Hi there. Good afternoon to the both of you. I'm wondering, since the number of children per caregiver has been so dramatically reduced, are you concerned about how many caregivers you have available? Have you considered asking teachers?
Well, and I would like Carolyn maybe to answer the first part of that, if you don't mind.
Absolutely. Thank you, Minister. That's an excellent question. So because the centers have been reduced considerable in their capacity, each of those centers have been able to respond to the immediate phase 2 reopening with either their existing staff, their substitutes, or staff from other programs. And so going forward with phase 2, staffing complements have been secured. We have been in touch with our operators regularly, daily, and had a meeting actually just this morning with the teams across the province, and they're in good stead to be ready to begin to operate within their limited capacity for May 22nd. Once, as the Minister has indicated, that those centers reach capacity and there would still be a demand identified, we would continue to work with the existing staffing complement to utilize space within either the public schools branch or the French language school board, and we're on track for that as well.
The second part of your question about, you said using teachers for childcare. So the teachers are busy with their role in learning. And of course, they've been reaching out to their students and working with them, making sure that home learning happens and their students are supported. So really, they're busy when it comes to providing childcare in the way that we're talking about here.
For sure. Thank you for that. What phase will the number of kids per area, per caregiver increase? When can early child care educators take on additional children?
Well, so this is the case with the pandemic. As we progress and things change, it really, it changes on a daily basis almost, depending on what's happening. And we saw today the phase 2 date was moved to June 1st, right? So it's really hard to predict that. And I don't know, maybe Carolyn wants to add to that as well.
Thank you, Minister. That's an excellent question. And as the Minister and I have said, we've been working closely with our colleagues at the Chief Public Health Office, and we're beginning those discussions for Phase 3 and the expanded numbers that we would be able to take on at that time. We'll have clearly more information on that next week as we begin to plan for Phase 3. We can say, the Minister and I together today, that infants will be able to be counted in the numbers going forward in Phase 3. And so centres are beginning to take a look at how they may be able to accommodate the infant group.
That's great news.
Thank you very much.
Hi, good afternoon to you both. I just want to be kind of clear on what I guess the expected shortfall of spaces is going to be. I think the Premier a couple of days ago had mentioned that pre-pandemic there were about 6,150 early childhood center spaces, and then close to 2,300 school-age care spaces. Mr. Trivers, I believe you'd mentioned that as of May 22, there will be 3,300, including both ECC and school-age care spaces. So what's the shortfall, or the expected shortfall, I guess, once this is all up and running as of May 22nd in terms of how many spaces there are versus the demand?
Well, Stu, thanks for the question. And that really is what we're trying to determine. This is the uncertainty that's involved, right? And that's why we have the form online for people to request care. And that's the way we're going to move forward. We don't know exactly what the demand's going to be, and we're going to rise to the occasion to support all families to meet that demand as best as possible. I don't know, Carolyn, do you want to add to that?
Thank you, Minister. That's a great question. And just to, when we say that we have just over 6,000 licensed spaces, including the 2,000 school-age spaces, we're anticipating about 3,000 between the regulated sector and the unregulated sector spaces will be made available. And as we go into Phase 3 and more businesses open, of course, we'll need to expand from there. But the emergency childcare that the Minister spoke about with just over 500 families, 90% of those families have made arrangements privately, and we expect that will continue, so that between the combination of families supporting each other, the licensed sector and the unlicensed sector, we do believe that we will be in very good position to meet demand. However, as the Minister has said, with the online the site that's online, to let us know what your demands, what your needs are, and we'll call and we'll work with families individually as well.
Yeah, okay. I guess just to sort of understand that point again, so I guess for the roughly 950 children who were from essential worker families, so 90% of those are basically being offered private child care services, mainly by a friend and grandparent. Do you get a sense of whether that's just because people were a little concerned about like the safety issues involved in enrolling their children in a sort of early years center or that sort of thing?
That's an excellent question. So if you were to go back in time to the beginning of the pandemic, there was so much that was unknown about COVID and the impact of COVID. And so in those very early days, there was apprehension on the part of the family, apprehension on part of the service deliverer. When you come to this point in time, and PEI has been so successful, we're hearing less that people are concerned about returning to their licensed care center, and people are more comfortable with what's expected of us with our social distancing and our extra cleaning of hands and so forth. So while that was a concern in the beginning, we're not hearing that as a concern right now, and centers have reached out and are filling those spaces, and that's not the comfort level for the staff and the families certainly has changed.
Okay, thank you.
Good afternoon to you both. I was just wondering about the physical distancing you talked about, Minister Trivers. Is it between the workers and the children, or even between the children?
Well, I think I'll let Carolyn answer that because during the emergency childcare phase, we have direct experience with exactly how that works.
Thank you, Minister. So all staff in the centers must at all times maintain physical distancing, and where possible with children to set up activities and the structure within their space for physical distancing. Recognizing with very young children that's not always possible, and indeed there will be time when children will need to be comforted and supported, and working with CPHO early childhood educators have been given strategies around how to physically be close to a child if the need be, and to ensure safety. And it's also important to note that there will be no child or staff member at any of the centers if they are unwell. So there's a screening process to do the best that we can to ensure that anyone who is there is well.
And just a follow-up on that, the children which will be with a worker, they will be always the same. I mean, it will be always the same group in order to ease the contact tracing in case there is a new case of COVID.
Yes, thank you. That's an excellent question, and for the clarity, absolutely. So the children will be assigned to a space in the center or a room, and one staff person and the same group of children, and that will not change. So they will spend their day with the same number, or the same children, the same educator each day as well, and for just that purpose. Thank you for that.
And I think we're going to end it there. I just wanted to say a huge thank you to all our early childhood educators who have really stepped up during the emergency childcare phase to make this happen with many uncertainties. And of course, that's exactly what parents and families are dealing with. So in these uncertain times, thank you to everyone who's really rising to the occasion. Thank you.